I'm going to start the webinar. All right, so people should be starting to come in now. We're live on Facebook and we're also recording, and I'm starting to see our participant count come up. Many of you know I'm Josh Mailman. I'm the president of NorCal Carcinet. We're going to wait just a few minutes to let things start percolating in different places and let people join in different areas. So we're waiting for that count to go up for a little bit. I think everyone can see my screen on the introduction. We've got still people coming in. And we're going to give it probably 2 more minutes to have more people show up. Just as a reminder, we use Slido as part of our way to ask questions. We'll do some of this, we'll show you 1 or 2 in a second of our surveys, but if you want to add questions into for Anne, who's up, who's with us from the East Coast today, feel free to add it at slido.com/netsmedi, my shorthand for Nets Medicare, and we'll get going. Let's see if I get to the right page. There we go. So I'm joined today by Anne Karish. She is the Senior Program Manager for Medicare for the National Council of the Aging. Hi, Anne. We did this, what did we do this? About 3 or 4 years ago now?
I think in 2017. Mm-hmm.
Right, and things have changed for 2020 and or 21. I keep remembering we're still in 2020, but it's nice to think about something going forward in 2021. And as part of what we were doing, we actually put out a survey that people can still fill in, but we had at least 50 people fill out the survey. And just so you guys, we wanted to tailor this for how you were all interested or what you were interested in hearing. And it looked like many people, and much like the last time we did this, were interested in how to select a Part D drug, and then about Medicare Part A and B, Advantage plans, and down the line. And certainly, I sent you an article earlier today about Medicare, which was done from the Yale study in the Medicare Advantage about choosing the wrong plan and how that really can impact your health. The next question we asked was where people currently are, just to give you an idea. And most of the people who were interested in this were interested in already have Medicare Part A and Part B, but there's some that have other things as well. And the overwhelming things that people are interested in, really, even though coverage came out the biggest in our word cloud, almost every other word is coverage in here. So people are interested in specific drug coverage, whether they will have coverage, what will happen to coverage for a specific net treatment, which probably is not unlike other things that you do in this area as well. So that's probably the biggest concern. And what I'm going to do is let you share your screen and turn it over to you, and I'll go monitor the questions, and we'll come back with questions towards the end, or if I see anything pop up that needs to be answered, I may chime in, but the screen is all yours. Feel free to share your screen, and welcome to NorCal Carcinet and the neuroendocrine tumor community.
Okay, well, it's telling me I can't share my screen while another participant is sharing. So
well, then I will stop sharing my screen and let you share your screen.
All right, terrific. All right, we'll give that a second. Okay.
Let's see if I can stop sharing my screen. All right, for some reason, it's not letting me stop. Hold on 1 second. Let's see if I can stop my screen. All right, let's see if you can do this.
Okay. not quite yet. Now, it's still telling me well, other participant is sharing. So, oh wait,
Go for it.
that looks like something indeed happened right there. Okay, here we go. Is that better? And let me go ahead
You got it.
and let me just do a slideshow here so it's a little bit better. There we go. And make sure I can get my, I don't know about anybody else, but I have trouble doing these little advanced buttons because they're so hard to see. But okay, nonetheless, thank you, Josh, for inviting me back to talk to the Northern California Carcinet community. It was back in 2017 that we were together. And a lot has happened with Medicare, and it's really understandable that folks have questions about navigating the maze of Medicare. Just as a little commercial break, I work with the National Council on Aging, and we really work to try to improve the lives of older adults. And one of the things that we do is help them with access to benefits, Medicare being a benefit. And we also work with trying to find benefits such as SNAP or the low-income subsidy, which is part of Medicare. So that's what we do as part of our mission. So I'm happy to be here actually talking with beneficiaries, because a lot of what I do is talking with SHIP counselors and helping them and providing resources to them. So it's nice for me to have an opportunity to speak directly to people who are working with Medicare or trying to understand Medicare. So on today's presentation or today's call, we're going to go through some basics really off of what Josh had indicated, the questions that you all had. We're going to go through our Medicare alphabet, exactly, Medicare A, B, C, and D. Take a closer look at your original Medicare and Medicare Advantage. Look at Medicare enrollment a little more closely, because there are a lot of questions that come up about Medicare enrollment. Take a little bit of a deeper look into Medicare benefit changes, which I thought would be helpful with your community. And then finally, do a Medicare Plan Finder demonstration. Get on Medicare Plan Finder and show how the Plan Finder is a tool to help find a prescription drug plan and also a Medicare Advantage plan. So that's the plan. It's a kind of a tall order for today, but let's get started if we can, okay? So hold on as I try to navigate my little buttons here, okay? Okay, all right, now, all right, here we go. All right, so first of all, what are your Medicare basics? Really, Medicare Part A, probably, as you know, covers inpatient hospital care. And not just inpatient hospital care, it would cover if you were admitted to a skilled nursing facility. It also covers hospice care, and it also covers things like your home health benefits. So that's your Medicare Part A. And it's usually premium free, meaning you don't have to pay a premium for Part A as long as you've had 40 work credits, okay? And that means you've worked for 40, typically it's 40 quarters. That's how it's looked at. Now, Medicare Part B is really the Medicare that most people understand. And that's your outpatient care. Typically, it's things like your doctor's office visit, or you go for an x-ray or testing. This is what Medicare Part B is. And the cost on Medicare Part B is $148.50 per month for 2021. And that was a figure that just came out late last week. So that is what you would pay for Medicare Part B and for that type of coverage. And normally Medicare for outpatient care covers 80% of the cost of the care. And that 20% coinsurance is something that would normally be the patient's responsibility, or you'd need to get another type of insurance, a Medigap plan, to cover that. And we'll cover that as well. Now, the Part C is where private plans really kind of come together and combine Medicare A and B, and they offer it through like a single private plan. And these private plans also have Medicare Part D or drug coverage with them. So your Medicare Advantage plan kind of combines a few of the different elements of Medicare. And the last piece, well, Medicare Part D is a prescription drug plan, D for drug plan. And then Medigap, as I had alluded to, is back to filling in the gaps of Medicare coverage when you have original Medicare. Let's look at this a little visually because I think it maybe makes a bit more sense when you look at it visually. All right. These are your Medicare enrollment options. Regardless of anything, you are going to need coverage for original Medicare, and that's Medicare A and B. But down here in the second part where you can see enhance your coverage, you can see where there's a path diversion. And if you go to the left-hand side, you're going to need to buy a Medicare Part D drug plan and a Medigap plan. And that would be how you get your full coverage. As opposed to Medicare Part C, you would have the Medicare Part C coverage, means you do not have to buy a Medigap plan. And like I said, most people have that Medicare Part D plan already in their Part C plan, their Medicare Advantage plan. So it's a path that you need to choose when you enroll in Medicare, how you want to have your coverage delivered. So we'll continue a little bit further with this comparison as to what do you really need to look at, okay? So here are some considerations that I think should come to mind. If you're going to enroll into a Medicare Advantage plan, there are a few things you want to know about it. For the most part, in a Medicare Advantage plan, you're going to need to work with a network of providers. And these are providers that work with and accept the plan co-payments and coverage that way. So you need to work with a network of providers, so know that may be limited. There will be plan co-pays, and there will be a limit on your out-of-pocket expenses. One of the nice features with the Medicare Advantage plan is that at some point in time, if your out-of-pocket costs for services, whether it's hospital stays or doctor's visits or getting that MRI cost, at some point you will have a max of that coverage, and you wouldn't have to pay any more for that year. So that's rather nice. And like you said, it often includes prescription drug coverage. I think it's like 90% of all Medicare Advantage plans do offer a prescription drug benefit. The important piece to know on that prescription drug benefit is that maximum out-of-pocket cost does not apply to drug costs. The maximum out-of-pocket cost applies only to services, not for drugs. All right, that is a different type of max out-of-pocket cost. Let's see, and with Medicare Advantage plans, they may offer some type of supplemental benefits, which you would not get coverage for under original Medicare. And these things are like maybe some type of dental or hearing or vision. And we'll see in a little bit how that type of coverage has really expanded over the past few years, really since 2017 when I was here last. The supplemental benefits under Medicare Advantage have really taken off and expanded. But it's also important to know with a Medicare Advantage plan, if you enroll in a Medicare Advantage plan, it may limit your ability to get a Medigap if you opt to leave that Medicare Advantage plan down the road, years down the road. And we'll discuss that more too. So let's talk a little bit more about if you opt to stay in original Medicare and not go to the Medicare Advantage route. Under original Medicare, any provider who accepts Medicare is a provider that you can see. There's not a particular geographic area it serves, so any provider that you would like to see, you can do that as long as they accept Medicare. You would be required to purchase a Medigap plan in order to really cover the gaps in Medicare, like I had indicated. Medicare typically covers like 80%, and that 20% you're going to have to buy a separate plan, and that would mean that would be a separate premium you would have to pay. Additionally, you'd have to purchase a Part D plan, and that would cover your prescriptions as well. So I think when you're under the original Medicare, chances are, I like to think about you're either having to write 3 separate checks or making 3 different types of payments. You're gonna have to pay for your Part B every month. You're going to have to pay for the cost of the Medigap plan, and you're going to have to pay for the cost of the Part D. So you could see 3 different premiums there, all right? With Medicare Advantage, you're certainly going to have to pay your Medicare Part B premium, but often you would just pay that single premium for the other coverage, all right? Just a minute. So now, the question that always comes up, and I think it really stymies folks when they go, when do I need to enroll in Medicare? I find it so confusing. When do I enroll? And I think this is a very, very common question. And the thing I think it's really important to pay attention to, there are really two ways to become eligible for Medicare, okay? Two things that happen that would make you eligible for Medicare. And the first is you turn 65, you have your 65th birthday. That means that you are eligible to enroll into Medicare. And the second one is that you are in your 25th month of disability, okay? And those are the two scenarios where Medicare becomes eligible. And then at that time, most people take Medicare at that time. So let's talk a bit about turning 65. The rule that I always use is if you're turned 65 and you are not working and you are not covered under your employer coverage or your spouse's employer coverage, then you need to enroll in Medicare. And let's spend a little time talking about active employee coverage, all right? That means that you are working now. Current coverage means that you have active employment. It's not COBRA coverage and it's not retiree coverage, okay? So if you are turning 65 and you are still working or your spouse is still working and you are covered under their insurance plan, that is the time that you can delay Medicare enrollment, all right? I think that's a lot of information to digest, but I think it's important to know that. Now let's spend a little time if you're going to get Medicare due to disability. You become disabled and you apply to Social Security and your benefits are approved. So therefore, in the 25th month of receiving your Social Security disability, then you are automatically enrolled into Medicare Part A and Part B. Now it's interesting to note that those folks who get on Medicare due to this disability, they are the only people who are automatically enrolled into Medicare. If you come in any other way, whether it's your 65th birthday or you join after you stop working, you are going to have to actively enroll into Medicare. And the way you do that is through Social Security. You have to contact the Social Security Administration. And you do that, you can do that by contacting or going to www.ssa.gov, and there's applying for Medicare that way. You can certainly call the Social Security office, and in a different time, you could certainly walk up to the Social Security office and stand in line and go that way, and that's not as available right now. So I would recommend doing an online or calling the Social Security office. So I think the other piece that confuses people is I am applying to get Medicare, but I go to the Social Security office. And that is exactly right. And I think that's a point of confusion for people. So know that when it's your time to apply for Medicare, the road through is through Social Security. The other thing that comes up a lot of times is, now that I'm 65, I think people often have the impression I can enroll into Medicare at any time, or I can make changes at any time. Well, that's unfortunately just not the case. There are specific times when you can enroll into Medicare. And this chart, I think, provides a nice graphic as to when you can enroll into Medicare and what are the typical Medicare enrollment periods, all right? Right now, we are in Medicare's annual enrollment period. And that annual enrollment period is where you can look to change your Medicare Advantage plan or your Medicare Part D drug plan, all right? And that annual enrollment period runs from October 15th until December 7th, with coverage starting on January 1 of the next year. So it'd be January 1 of 2021. So right now, people are really looking at, checking out their Medicare Part D drug plans and their Medicare Advantage plans. Each year, if you're in Medicare and you're enrolled in a plan, you get what's called an annual notice of change. It's a packet that comes and it tells you all about the changes that are happening in your plan for the year. And it really is wise to take a look at that packet because it talks about what's going to be different for next year. It will tell you if something's not going to be covered, whether that's a drug or a service, or if there's a cost change or something like that, that will be on that information as well. So that's really what arms you and prepares you to know if there's changes in your plan that you're using for next year. So that's your annual enrollment period to change your Part D drug plan or your Medicare Advantage plan. The next period I want to talk about is your general enrollment period. And this is for enrolling into Medicare Part A and Part B. All right. Say you're one of the people, your 65th birthday came and your 65th birthday went, and you didn't enroll in Medicare because you say, well, you know what, I just am not sick, or I don't take drugs. I don't see why I need to enroll. Well, that's certainly your prerogative not to enroll, but you just need to know that there are going to be consequences for that. And one of those consequences that the only time then you'll be able to enroll into Medicare is during this general enrollment period, which runs from January 1st to March 31st of each year. And then coverage doesn't start until July of that year. So know that if you decide that something's come up and it's August and you would like to enroll in Medicare, know that you will not be able to get Medicare coverage until the following July 1. So it gives you another reason why it's really important to enroll in Medicare when you are first eligible. There are also penalties for not enrolling into Medicare when you're first eligible, but we'll get to those in just a minute. The last notice here, then the last bullet here is about notice. There is no annual enrollment period for the Medigap plans. Let's think back for a second when we were looking at our two choices for Medicare, when we were going to stay in original Medicare and we needed to have coverage for those gaps in Medicare, that 20% coinsurance. That's what we're talking about here, okay? There's not an annual enrollment period for a Medigap plan. You have one Medigap open enrollment period, and that open enrollment period for a Medigap is when you are both on Medicare Part B and 65 years old. When both of those things are true, then you have a Medigap enrollment period, and that begins, and it's a 6-month period, all right? And that means during that time, you can enroll into any Medigap plan that you would like. So being able to enroll in many Medigap plan that you would like, that means you will not have any pre-existing conditions and you cannot be turned down.
So Anne, just
Yeah.
a quick question there, since
Sure.
you know you brought up the Medicare enrollment for those who are on their 25th month of disability. How does that Medigap open enrollment period work for that, given that right here the guaranteed issue right is the open enrollment is really only when you do both the turn 65 plus and enrolled in Part B. So can you go over that? Because I know
sure
a lot
can.
of people in this community are under 65 but still on disability.
Absolutely, that's a really good question. The answer to that question, unfortunately, is there's not a federal guarantee issue right for people under 65 for a Medigap plan. There are states that do provide that type of that open enrollment opportunity, but not every state does, because Medigap plans are state regulated as opposed to federally regulated. Then that is why that there's not a guarantee issue right for the under age 65. And so that is why there are many times people who have Medicare, who have it because of disability, do not have a Medigap plan because it's not required by the federal government.
Okay, that's a challenge, obviously, because that leaves a 20% hole in Part B, which we can talk about later, but I'll let you continue.
Yeah, no, that's a really good, that's why when you have to be both 65 and enrolled in Part B. And these are the little complications of Medicare, the nuances that are very, very difficult, right?
And I know that things change, obviously, when the ACA, but right now, some of us are using not an exchange plan, but a ACA plan to cover that Medigap area because there's no pre-existing conditions in current ACA plans when you get them off exchange currently. So you can use that as a Medigap plan as well.
Yeah, and I can see where this can be costly because you have, you know, it's just you, it's one thing, but then if you have a family, you have coverage there and then coverage for yourself. Yes, it can be very costly. Thank you for Josh for it's a really important point. It's a really important point. So remember, so let's say you're an individual who you were losing your employer coverage. So at this point, we're going back to the folks who you're turning 60, you're now 65, and you continue to work because you're continuing to work and you didn't take Medicare, okay? So no, and so because you had active employee coverage. So you didn't have to take Medicare. So know that when you're no longer working and now you're 65 and now you take Medicare, you can still have a Medigap guarantee issue period, but you have to do that within 63 days of losing your employer coverage. So that is some of the ins and outs of getting your Medicare on time during the right period. So hold on, I'm going to advance my slide. So let's talk a little bit about some of these late enrollment penalties, which we really alluded to earlier. So know that if you are eligible for Medicare and you do not enroll into Medicare Part B, when you're first eligible, then you can be subject to a penalty. And that penalty is a 10% for every 12-month period that you were not enrolled in Part B. So just know that, and that's 10% that's added to your Part B premium, okay? And that's a penalty that's going to last as long as the person has has Part B. And for most of us, that's going to be for the rest of our lives, all right? So not just are you going to pay an increased amount of Part B premium, you also have to understand that you're not going to get coverage just when you need it. You're going to have to wait and enroll in that general enrollment period and have coverage beginning July 1. So keep that in mind. It's going to cost more and you're going to have a delay in coverage. So that's the general late enrollment penalty. And let's keep in mind, right now, I think it was $148.50 is what the enrollment premium is for Medicare Part B right now. So you take 10% of that, is like, what's that, $14 or so that you're going to be paying on top of your Medicare Part B premium if you're paying that the standard premium for Medicare Part B. So let's look at our next one. Let's look at the late enrollment penalty for Part D. And again, Part D is the penalty that is for any time you should have been enrolled in Part D drug plan, but you were not, you are going to be penalized, all right? And it really is, it's calculated by multiplying 1% by the national base premium, which in 2021 is $33.06, for the number of full uncovered months that you didn't have a Part D or didn't have credible coverage. And this is again added on top to your Medicare Part D premium. All right, so that is what you would be paying. So know that not having Part D coverage is something that you'll pay a penalty for. And I know what you hear a lot is, well, I didn't need drug coverage because I wasn't taking any drugs when I first became eligible. But this is an incentive to have you select and have a plan right from the very beginning of your Medicare eligibility. Okay. So what I'm saying to you is don't procrastinate on enrollment, all right? If you have questions as to where to go for coverage or who to talk to, I really recommend you speaking to a Medicare counselor, and there are SHIP counselors available across the country in each state, and really I think in most counties there are Medicare counselors. And if you don't quite know how to find one, here's a website, the shiptacenter.org can give you access to a SHIP counselor, and I have a phone number for them in my resource slides as well. All right. So that gives you just gives you a kind of a groundwork for some of the basic questions on Medicare. And if we have other ones you want to talk about, I'm sure we'll have some information and we'll have some additional questions in our Q&A portion of the presentation, okay? But I'd like to spend just a few moments on some of the changes that have happened in Medicare over the past couple years. And by no means do I want you to think that these are the only changes that had happened in Medicare. I've just highlighted a few which I thought would be relevant to this community. So let's talk about some of those. All right, just let me get a minute to take a drink. Since we talked back in 2017, the Medicare Advantage plan, and this slide and these benefits are strictly for those folks who are in Medicare Advantage or considering joining a Medicare Advantage plan. One of the nice things about being in a Medicare Advantage plan is they can provide coverage for things beyond what original Medicare covers. And this slide really gives you a nice idea of some of the types of benefits that are available under plans, what they offer. You know, they offer fitness benefits or dental benefits or eye exams. And over the past few years, we've seen an expansion in the types of benefits that supplemental benefits Medicare Advantage plans can offer. They've moved into things such as providing transportation, maybe to the doctor's office, or even a home delivery of meals, or paying for some over-the-counter items, or maybe safety devices in your bathroom. And there are some plans I know that have options where you can get maybe like a home filtration system if you suffer from asthma. Now, all these look really good, but I think there's a lot of caution that should be known. Number one, there are limitations on the benefits. If you know of a dental benefit, it's not everything is covered. There are limitations or how much the benefit is. You know, they may cover indeed transportation, but they may only cover 5 trips to the doctor's office per year. So while these are all really great, you just want to make sure you know what the limitations are. Another thing, it's important to know that not all benefits are available to all people enrolled in a Medicare Advantage plan. Sometimes your diagnosis has to be such that entitles you to the benefit. And the somewhat disappointing piece of this is you may enroll in a plan and the representative you talk to, or maybe you enroll, they don't know and have no way of knowing for sure if you're eligible for that supplemental benefit. So I caution folks, if you're going to enroll because of these supplemental benefits, you really want to make sure you do your research and make sure that they're going to be something you can be eligible for. I want to mention just a little bit about telehealth. Now, this is available, and most of you maybe have had a chance to experience telehealth. This is a benefit that's available through Medicare Advantage plans, but it's also a benefit that's available to folks who are in original Medicare. And again, a telehealth visit is a visit where you can basically have audio-visual communication with your physician or with some type of a therapist or something like that. It's a way of not actually going to see the doctor, but having the doctor or the healthcare professional see you over online, or even sometimes counseling can be done over the phone. Know that this has been expanded partially because of the COVID-19 pandemic, but also know that Medicare has been moving in that direction anyway. What I want to mention, and which comes up regularly, is how telehealth is often is ridden with scam artists or fraudsters. We have found and we have heard about where beneficiaries or people have been told, they've been contacted by a doctor maybe they saw years ago and saying, oh, I'm just calling to check in on you. And so oh, that's really nice of you, doctor. And it used to be something that they thought was a courtesy. Well, then they get a bill from the doctor. So just because something is done via telehealth doesn't mean there's not cost associated. There are indeed costs associated with telehealth benefits. If it's an office visit, you're going to have a standard office visit copay or standard office visit coinsurance. So know that when you're using a telehealth benefit, make sure that it is with a provider that you know. Make sure you're not giving your beneficiary or your Medicare number, any type of private information out to someone who calls you saying they're arranging some type of telehealth visit. We ask you to make sure you're cautious. know that telehealth visits are arranged in advance, and they should be a length of time that is similar to the appointment itself. So I just want to make sure I mention that, because it's something that is certainly people are being taken advantage of, and you want to make sure you always raise a bit of flag of caution to people. All right. Another benefit that has changed since last time we had gotten together was this is under the Medicare Advantage plans. There are now some plans have instituted step therapy for Part B drugs. Now, many of you know that some of the drugs that you are, especially drugs that are maybe infused or injected, are covered under Medicare Part B as in boy, and not through Medicare Part D. You're not going to the drugstore anywhere to pick them up. So know that some Medicare Advantage plans are putting restrictions on Part B drugs, saying that you need to try a cheaper drug first before you use this expensive drug that you want to use, okay? Now, there are some limitations on how much they can do with this step therapy for these drugs. First of all, if it's a drug that you have been using within the past 365 days, so you were given this infusion last month or the month before, or even 11 months before, that is not a new start. These Medicare Advantage plans can only put this step therapy restriction on new starts of drugs. So if you're currently taking that drug and you're moving to a Medicare Advantage plan, they cannot put this restriction on you, all right? So know that. So again, what the step therapy is that it would allow them to first require you to try this cheaper therapy and basically fail on the cheaper therapy or not thrive on the cheaper therapy before they give you the other drug. So now let's know that you can appeal this. There are requests for appeal that you can do. And typically those exception requests usually happen within 24 to 72 hours. Another limitation we're seeing is that they can cross-manage. They can require that you take a Part D drug before you use this Part B drug. So know that there are definitely things happening with these Part B drugs that if you're looking at Medicare Advantage, it's something you want to make sure you understand before you join. The other interesting piece of this, that this is not really clear on Medicare Plan Finder. It's not something that's readily available and visible on Medicare Plan Finder. So I would say if you're going to be thinking about joining a Medicare Advantage plan, this is a question you want to make sure you raise with the plan before you join. All right, let's go to the next slide. The other piece I wanted to make sure that you know about Medicare Part D plans is that they have moved to what's called the indication-based formulary design, okay? An indication-based formulary design really allows plans to look at coverage for drugs on an indication by indication basis, meaning they'll cover for one indication, but choose not to cover for a second indication, okay? Now, plans must have a therapeutically similar drug on their formulary for that non-covered indication. And again, what this means is that if you want to request an exception, that's something you can do. And typically those exceptions take a response is done within 24 to 72 hours. But let's go through and get an idea. Let's say I have an example of one of these indication-based formularies, okay? The example I choose here is for Afinitor, and it is FDA approved for both renal cell carcinoma as well as for breast cancer. And an indication-based formulary allows, it could say, we're going to cover it for breast cancer diagnosis, but it's going to be off formula for a renal cell carcinoma diagnosis. So that is something that started, last year in 2020, that became effective. So what you need to know is that in this particular example, that there are other drugs that had to be made available for the renal cell carcinoma. So that's what this rest of the slide is showing. Okay. So that takes us through really the different types of coverage changes, which I thought would be most interesting or most pertinent to this group. And I now at this point, I was planning on, starting going through Medicare Plan Finder, but I don't know, Josh, if we wanted to take a minute and answer questions, or you wanted to go through Plan Finder and how to select a plan first. So I don't know, I wanted to pause and check in with you if I could.
So, right now we only have one question that's holding up in the questionnaire, and one of them, it's about the donut hole, which is a Part D thing. So good to throw it in there. So if you actually want to answer a little bit about the donut hole right here, and then we can go into Plan Finder, that would be great.
Okay, terrific. All right. Okay, so this question of donut hole, I have several different thoughts on it. And let's just say this. Right now, what you're going to hear is language, the donut hole is closed. As of last year, you're hearing the donut hole is closed. What I think people interpret that to mean is that I have no cost in the donut hole. And we'll talk in a minute about what that means, but I want to just dispel that myth. Just because the donut hole is closed doesn't mean that there aren't costs associated with the donut hole. So let's talk a bit about the Part D benefit is rather complicated, okay? When you're in the Part D benefit, there are different phases of the Part D benefit. And that's why I think when people go to the drugstore, they show up, and every time they show up, they feel like I'm paying a different amount for the drug. Well, that's certainly possible because it means you're in different phases of the donut hole. Typically and often there's a deductible, and in the deductible phase, and I wish I had a slide about this, and Josh, I'll include a slide on this because I didn't include it here. But when their initial deductible phase, that means you as the enrollee you bear all the costs. So whether it's a $100 deductible or a $400 deductible, that is your cost. You move into the second phase, which is the initial coverage phase. That's when the drug plan and the enrollee start they share cost. And the standard benefit is that the beneficiary pays 25% of the cost and the insurance plan pays the 75% of that cost, okay? But that's the standard benefit. There are other ways. Plans can decide not to be standardized, and they say, I'm going to have you pay $33 for this, or I'm going to have you pay a flat fee instead. So that exists until you reach a threshold of, I believe it's over $4,000. When what the plan pays and what the beneficiary pays reaches over $4,000, then you move into the coverage gap. In the coverage gap, now it is that now the donut hole is closed, or the coverage gap, because the donut hole and the coverage gap are referring to the same things. Now that 25% coinsurance becomes the beneficiary's responsibility still. So that 25% coinsurance is what the beneficiary pays in the donut hole now, okay? And when they're closing the donut hole, before, the donut hole cost was 33% of the cost of the drug, or 50% of the cost of the drug. Now in that donut hole, it is 25% of the cost of the drug, and that remains constant until they reach the threshold, which is the catastrophic threshold. And then you have a very inexpensive cost, which is 5% of the cost of the drug. So it's all these different layers that you need to go through in order to reach it. So I don't know if that answered the donut hole question or not.
So, complex terminology here. And one thing, and going through the Plan Finder will really help with this, because I think the Plan Finder actually goes through the what your coinsurance cost is as well, which gives you the idea of what that part is. You'll see, because there's also a detail of month by month where you can actually see that coinsurance go up until you've hit that catastrophic amount, and then it goes down again. So I think it's a great time to go through an example, and I'll let you go to it and share your browser and
Sure.
Let you run it.
Okay, well, again, just so people know, what is the Plan Finder? It's the tool to enroll and then to look at and shop for Medicare Advantage and Part D drug plans, okay? It gives you basic plan information. It's always wise to check with the plan before you enroll, okay? What I want to mention is, if you want to get specific information about you would want to now use a mymedicare.gov, a My Medicare account, okay? Before, you were able to use a a browse feature, and you could put your Medicare number in there and it would pull out some customized information about you. Now, in order to get that same type of customized information, meaning it would know what your current plan is, you would have to establish a My Medicare account, okay? Now, the only thing you can do you can certainly do anonymous browsing on Medicare.gov and on Plan Finder, but just know you can't save your drug lists, nor are you going to get specific information about yourself. So, so these are just some of the features. Like I said, if you have a My Medicare account, you can get specific information about yourself and you can save your drug list. Without it, you cannot save a drug list. So I think I have in here, the next slide is how to set one up. This is a nice little YouTube video one of our grantees had created, and one of our partners, and I would recommend if you want to set up a My Medicare account, that would be the way to do it. So that's going to be available. So why do you want to check your drug, why do you want to check your plans every year? You want to check your and potentially change plans because plans change every year, okay? Some guidelines when you're looking at what should you include and what shouldn't you include. You want to make sure it's, regular. You only want to include drugs you take regularly. Unless you take antibiotics every month, don't include them. Like if you're taking antibiotics because you have you get an infection or something like that, that's not what you want to include on your Plan Finder list. You want to make sure you know that your dosages are correct, and make sure you know your strengths and how much you use, and whatever you're taking, make sure you know how much you take. Because if you don't, that could really hurt the results that you get. And remember, this is not for Part B drugs. This is only for drugs you're going to pick up at the pharmacy, okay? And keep in mind that you're always want to make sure whether you're going to be picking your drugs up at the retail pharmacy or you want to use mail order options. These are questions you want to have the answer to before you go on Plan Finder, okay? So this is the Plan Finder. This is where we go, Medicare.gov. This is going to be Plan Finder. So I'm going to go ahead and get a new share started, okay? So I have to stop this share and I'm going to get a new share, okay? So hang on just a second. Share my screen. And let's get my glasses on here. And find my, oh, sorry about that. Let me just do this. Get a new screen thing going here. All right. Okay, I'm sorry. Sorry about, and I should have had this all set up and I didn't. Okay, tell me, are you seeing it's open enrollment now?
It is open enrollment now.
Excellent, good. All right, so that's exactly where we need to be. So this is the My Medicare, this is the Medicare.gov site. Sorry, I went a little like crazy there. Where you need to be is that at this little purse here, you need a 2020 plan. That's where you want to go to start Plan Finder, okay? So here we go. Now, this is what I was just talking about. You can log in or create an account. That's your My Medicare account. If you do not have one, it's perfectly fine. You would just go continue without logging in, all right? So you continue without logging in. You're going to need to answer a few questions, all right? This is where you're going to choose whether you want to enroll in a Medicare Advantage plan or you're looking at a Part D drug plan, okay? I always like to start with just enrolling in a drug plan because a lot of times I find that it's just a little bit simpler, and we'll start there. So I hit the button where I want to add a drug plan because I have original Medicare and I need to add a drug plan. Now I want to make sure I have a zip code. So I don't know, I thought I was in California. So I had to call, I was going to use the 95366 zip code just because I thought someone might be living there in that general area. So we'll put that in your zip code. And what it's telling me, oh geez, sorry about that, guys. Let's see. I left my share. I don't know how I did that.
Oh, you're still here.
Am I still here? But I'm not. Yep. I'm not. it's not on my side. It's not for me. I kind of came off of it.
That's okay. You can just hit continue and we can see your screen.
All right, continue. I'm trying to get on there. Hang on, give me a minute. Where is my screen? Now there's, come on. Come on, Annie, you can do this. No, why? Hang on just a second. There. All right, hold on. I'm the only one that can't find it. All right. Geez. Talk about keeping you guys in the lurch here. Hold on just a second. Let's try that. There we go. I got it. Okay. Can you see it now? You always could see it.
Yep.
I couldn't see it.
You got it now.
All right, there we go. All right, so here we're hitting continue because we can see we're in San Joaquin, California. All right, continue. All right, come on. Oh, sorry, I didn't scroll down far enough. That's why. So now you need to say, answer this questions. Do you get any help with any of these programs? Well, for our purposes, we're going to say we do not get any help from these programs. These are all types of programs that help reduce your Medicare costs. But in order to get a good idea of what it costs, I think it's important to see without the help of assistance programs. And yes, we would like to see, we want to see drug costs. So we're going to enter some drug costs because that's an important feature of the plan finder. So I'm going to say yes. And I would really recommend that you fill your drug. When you answer this question, you put both, because you really want to see what it costs at the retail pharmacy and you want to see what it costs at the mail order pharmacy. So that's something you want to do too. Okay. All right. So then we are all set to go and to enter drugs. So you know that we want to see drug costs and we want to make sure we're filling our prescriptions at both the pharmacies. So this is where we begin adding drugs, adding your prescription drugs. And Josh was good enough to give me a few drugs to enter in that seemed to be commonly used here. And so it was the Zen Pep. So you can see when I put in the ZEN, this drug automatically pre-populated. So I'm going to add the drug. And then it's asking me to select the dosage. So I'm going to hit the this drop-down list, and I was indicated that a common dosage is, I don't know, 25 to 25,000, was that 25,000 K? Yeah.
Yep.
So I'm going to put down this 20,000 to 63,000 feature, okay? And I'm going to say we need, is it one a day, 30? Is that a good?
More like 60 to 90,
60?
but let's use 60.
Let's use 60, okay, and that's every month. And then we're going to add it to my drug list, right? So we can see that there is the drug that we just entered, and we want to add another drug. So I'm going to find another drug, right? So the next drug was Zermello, which we are, and there, as I was typing it in, you can see the drop down there list there. And Zermello, I'm going to add this drug. And similarly, it's going to require that I put a dosage in. And for my purposes, there's only 250 milligram tablets. So I'm going to put that in. And what's the quantity on this one, Josh?
Have to think about that, but let's start with 30.
Start with 30, okay? So that is, we're going to then add that to my drug list. I'm going to add one other one just because I know I'd like to add one that makes sure that it's expensive, or sometimes there's some kind of restrictions on it, just so you guys have an idea. And I know it may not be a drug that you take, but quite honestly, Plan Finder does not in any way say, oh, you already have a drug like that. Do you want to put this other drug in? It doesn't. It will just let you put in drugs that are very similar, or drugs that may not be, it doesn't look at anything beyond, it's just purely an add-on list. So let's find another drug. And for this purposes, I'm going to put in Oh, let's see. Let's do it. It's a Revlimid. I like to use it because I know it's expensive, and I like to know whether it's covered or not. So, there we go. All right. Right. Okay. So now we have our drug list. All right. So this is all our drug list. This would probably be a good time to make sure your quantities are there, then they're accurate, and your dosage is accurate. And if you want to, you could edit. If something wasn't wrong, you could edit right here. So that's good. Now, I'm going to say that we are done adding drugs, and this is the time we need to choose pharmacies. We can see that we can choose up to 5 pharmacies, which is up from last year, because there used to be just 3. So now we can use 5. What I want to mention here, you can certainly, if there's one pharmacy you like to use, you can put the name in here. You can do that. Normally, I just scroll down the list, but I want to note here. This distance, you want to make sure it normally defaults to 1 mile. So you may have to go up to 5 miles or 10 miles, and that just gives you the radius. And so let's say we have to do 5 miles, and let's see what our choices are. So I apply that, and
Now, I know you and I were talking that there was some limitation in the first release of this as to what pharmacies were included.
Right, that's been fixed. They updated. Yes, you are correct. When they first, there was some issues with some of the plans, all the pharmacy information was not coming across. That's been changed.
So if they did this early on in the open enrollment period, they may need to redo it because all the pharmacies may not be there.
And quite honestly, what I would tell you is if I would do it once and then I'd wait a couple days and do it again and see if you come up with a different answer, quite honestly, because I'd like to say it's perfect, but it's not. And I would do that if I were you. I just would. So let's pick a couple pharmacies. Let's pick CVS. I don't know. Are these standard pharmacies for all of you?
CVS, Walgreens, Costco, I think we're good.
Okay. All right. Well, let's just do that and say we're done. Okay. That gives us 4 pharmacies. Now it's loading our prescription drug plans. This is like your list of plans. And let's take a minute because I think it's important to make sure we understand what we're looking at here. This is going to be all the drug plans that are available in your area, in your service area, basically. So it's telling us there are 32 drug plans available, and it is sorted by lowest drug and premium cost. There's alternatives to sort by lowest deductible or premium, but why would you do that? You wouldn't do that. Do not do that is what I'm telling you. Do not do that. Sort by cost, because you want to make sure your costs are as low as possible. We're looking at a really like a little shortcut. It's telling us for this Mutual of Omaha RX Premier plan, the premium is $24 a month. Our 33 of our pharmacies are in network. And it's telling us our retail cost for these drugs is $19,000 or $20,000 if we go to the mail order portion. So something obviously is not covered. So we're going to find out what that is right now. So, and it does have a deductible. So let's go into the plan details here. All right. So what I did was we're moving from a list of drugs into details on a particular drug. This is the drug that came up through a sort that is the least expensive. All right. I'm kind of afraid to see what we're going to find here. All right. So here's a repeat showing us what the premium is, what the deductible is. And now we move into drug costs. There's a lot of information here. So I would just say, take a breath. As we scroll down, you're going to see a lot of information. This first set of numbers really tells you how does this plan look at the different types of drugs. There are different tiers. They're saying preferred generics cost $0 in the initial coverage period. Just generics are $2. Preferred brand, the non-preferred brand, the specialty tier drugs. These are coverage in this initial coverage phase that we had briefly mentioned. And you can see there's another column, which is the cap coverage. And then there's a third column, which is the catastrophic coverage. You can see that this shows you the different phases of the Part D benefit and how complicated it could be and how costs differ in each of these phases, okay? So I want to keep scrolling. It tells us all of these plans they're either a standard in-network pharmacy or a preferred network. Typically, your preferred in-network pharmacy is the least expensive, okay? So let's scroll to the CVS because I know people are anxious to get there, all right? Here's our Costco. I'm going to skip Costco just because it's a standard network pharmacy, and I want to get to the preferred network pharmacy, okay? Just because that's where our drug cost should be the lowest. I want to spend time there. So here's our CVS network, okay, or CVS pharmacy. And as we can see, we've got costs here, pretty high costs. So I want to go down here because I don't want to be behind our faces, Josh. So we can let's look at your drugs, the drugs that you all mentioned. So here, it's showing that the retail cost of the drug is, over $2,200. The cost before the deductible, which is really the same, which is $2,200, the retail cost. But after the deductible, we're showing it's $574. And in the coverage gap, it's $574. And then we get to the cost after the coverage gap, it's $114. So I'm thinking what that means is, okay, just bear with me, if you will, okay? So let's see if we can try to see where this $2,000 or this $574, it typically should be like 25% of the cost of the drug. But let's see so this is in the cost after the deductible phase. So I'm scrolling up here. So I know, hang on. The reason that it's that cost, because it's telling me is it a preferred brand, and the cost in the initial coverage phase, say it's 23% of this preferred brand. Or maybe it would have been a non-preferred drug and it would have been 44% of the cost of the drug. Or a specialty tier and it would have been 25% of the cost of the drug. So you can see there's a lot of information here to digest. All right. So just know, but that is how you can try to figure out how much these drugs are costing you. Is it 23% of the cost of that retail cost, or is it 25, or is it 44% of cost of that drug? So you can kind of see where that's coming from, but that's what I wanted to show you. That's how you're trying to figure out where these drug costs are coming from. This ZenPep, we can see that it's the same exact cost throughout the life of the benefit, which means it's not a covered drug. This drug is not covered under this plan, okay? And the Revlimid, I'm just put it in there. It's just a high cost drug, and we can go. So what you want to do is, this is what it costs. So let's go and see, how do we know if these drugs are covered, okay? There's a lot of scrolling here. And I'm going to scroll down below all these different pharmacies, because what we're doing, we put in pharmacies and it's going to show us the cost at each pharmacy. It was showing the cost at CVS. It was showing us the cost at Costco. It's now showing us the cost at the mail order center. It's the same drug phases, but it's the cost. You can see they're all different with all these different plans.
But it's interesting that the ZenPep that you showed, which is the same drug, is costing, even though it doesn't seem to be covered by any of them, even just the retail cost is wildly different between the facilities.
Yep. I kind of feel like it's the Wild West in a lot of this, Josh. The costs are all over the map. They really are. That's why it's so important you do this exercise. So, okay, so what I'm trying to get here is actually down here, which is this kind of the limitations on these drugs. What is it telling us is this ZenPep is not covered, as we suspected. Whenever you're saying that same cost over the whole course, that means it's a not covered drug. Ursomello is a tier 5 drug, which means it's probably in that specialty tier. So it's the 25% of the cost of the drug. It's telling us it would need to be prior approved. So this is one of these drugs. I would be strongly recommending that you call the plan, because it could be it's one of those drugs that it's an indication-based therapy, and you want to make sure it's covered for your indication that you're taking it for, okay? And if there was a drug that was subject to step therapy, meaning they're going to require you to do something cheaper and possibly less effective, it's going to show up in the step therapy column, okay? Quantity limits is pretty much what it says. It says that we are limiting, maybe you said that you take 90 a month. Well, maybe we only covered 60. So it's say you're going to come up a monthly limit on how much it covers. So these are all questions that you need to evaluate as you look through these plans, okay? So that gives you a general idea. So to do this. And again, this is the detail for one plan. We're looking at a single plan, all right? Now, quite honestly, that was the least expensive plan. And how I always do everything on Plan Finder is I use our back buttons, because, or you can go back to search results. You want to follow the rules on here. So we're going back to search results. And if you remember correctly, this is back on this 32 prescription drugs available. Mutual of Omaha was our first pick. And it was telling us that our total drug costs were $19,000. If we go below here, this was Mutual of Omaha RX Plus, which is different than Mutual of Omaha RX Premier. You can see how these names are very similar, and you really need to know which plan you're going to enroll in, because a name difference can really be a huge difference in the plan coverage. So that one would cost $19,976. And again, you would need to go into the plan details and do the same thing for that. And I don't think we need to go anymore. Then you go to Clear Springs, you can see the cost is $48,000, which would mean probably there's more than one drug that's not covered. So
just quickly, can you take the non-net drug out to see how that drops out? Because I think a lot of people seeing $48,000 are probably a little freaked out about what this is going to
absolutely. Let's see how we would go ahead and do that. Okay. So I want to edit my drugs, and that's pretty straightforward. So I just go here, edit my drugs. I want to remove this. Okay.
That would be on the left side. It said remove drugs.
Yeah,
but that's all right.
But yeah, I just removed the drug. Remove it. Yeah, I want to remove it. I thought I did.
No, you clicked on the right side, which was edit the drug. The left side is remove
it. See, well, okay, we will just remove the drug. I'll just
hit cancel.
Yeah, we'll just go. I just want to see this. Want to cancel that, and we'll just remove this.
There you go.
There we go. Okay, so I successfully removed it. So now we are left with our two drugs that are meaningful to you guys, okay? So let's go ahead and let's see what we're done paying drug cost. And we're gonna keep this, we're done with that. We don't need to review any of those. And now we're loading it. Okay, so let's see what our costs are now. We're back to $9,000, okay? And if we want to go into the plan detail page a little, let's go into the plan detail page. Okay. Again, this is how the drugs are going to be covered for the different tiers. And again, Costco costs, which is a standard in network, versus your pharmacy, your preferred CVS pharmacy. And you can see the costs here. Again, you're looking at that, close to $500. And then then this close to, similar, then it's, $574 here.
Can you go back to the summary page real quick?
Sure can. So yes, let's go back to the top. I'm going to go back to the results, search results.
Yeah.
I want to make sure people see how to do that though. Back to the search results. Okay.
So one of the things that one of our members have pointed out is, how do we interpret the star ratings here? Because we see the Mutual of Omaha is 2-star, even though it's the least expensive. What's the next one down real quick?
Mm-hmm. That's Mutual of Omaha
Well,
also.
yeah, twice.
Okay, so it's not a very good star rating. And it's quite surprising that these are such low star rating clients, because quite honestly, typically, how you want to do this is Medicare has a whole series of quality ratings. Your star ratings are quality ratings, okay? And what it takes into account is some of it is like customer service. Some of it is how are they communicating with beneficiaries? Others is, do they provide accurate information to the plan? There's a whole series of measures and that they have. So to have, quite honestly, if you have a 2-star rating, that would be pretty hard, because most plans have a higher star rating. Quite honestly, there's a complaint out there that too many plans have like a 3.5 to a 5-star rating, and it's almost like too many have that. So does it feel like it's a real measure? So so typically I would say your average rating is higher. It's like 3 or 3.5, I would think, is a higher rating. It is definitely, you can actually click on some of these star ratings. Let's see if it takes us to it. And you can learn more about what the star ratings are. It will take you into a whole explanation of what the star ratings are. But keep in mind, it measures a lot of things that may or may not be valuable to beneficiaries. It could be the way it communicates with Medicare. It may be the way, how quickly does it update something. So it's a lot of measures that may or may not be relevant to beneficiaries.
And can you go back up to the top again?
Mm-hmm.
And I know you said it's really important to, take a look at sort plans by lowest drug plus premium cost. Although we certainly have a lot of people who just, so here the lowest cost is about $9,800. The one with 3 stars is about $10,000 a month, or $10,000 a year, I should say. Can we just show what it looks like if we do the lowest premium cost?
Oh, that is a really good idea.
Right,
Yeah,
because a lot of people just say, I want my lowest monthly premium.
Right.
So here's one that costs $7.20 a month to cover, but it's yearly drug. Having chosen this, it's nearly 20, is that right? 40, it's $30,000 more than the lowest one that charges $20 a month. So here, if you've selected the lowest monthly premium and it has a decent, certainly star rating, it certainly would cost you a ridiculous amount more to run. I'm curious what the next one down is.
Sure.
After 720, but that's, clearly, just going by premiums is a really dangerous thing to do. Just looking at these 2 drugs that people in this group use, you could be in a world of hurt and a world of deciding not to take a particular drug because you just can't afford it, and it would take a while before you could go to a different plan. The other challenge, of course, is that a lot of these copay assistant plans do not work with Medicare, and making it more challenging when you get this number to see, well, I can't take this drug because it's going to send me, forget the donut hole, it's going to send me into bankruptcy.
Exactly. The other piece.
And this is an amazing little, just on these 2 drugs, the difference is what, 4,000? Is that right? $2,500 a month.
Yeah, it's a lot.
That's frightening.
It's frightening to pick the wrong plan. This would be a catastrophic.
Mm-hmm. I don't like to use the word catastrophic all that much, but this is catastrophic. I'm actually have not run this particular scenario, and that is particularly scary.
It is.
Great. And so, we use the Medicare tool here to work on Part D. This would also work on Advantage plans as well, and Medigap plans, correct?
Yes. It would, Medigap, yes, Medicare Advantage, it's a very similar setup. It would be, yes, you would do the exact same things. We would just select we want to see Medicare there. Quite honestly, we can just do it very quickly, quite honestly, because if you go to the very top here, you can view 26 available Medicare Advantage plans. So, you know, we can just look at that quickly. And what it'll do is load up the Medicare Advantage plans. So you can see this, here's the Medicare Advantage plans. And you can see with the brand new day Classic 2 plan HMO, your cost would be $3,829. And this is your yearly drug and premium cost. Okay. So we can do a similar type of thing, but I think it's also worth noting that there are other benefits available here as well. And I want to just scroll down here. And again, it shows it includes drug coverage. So do you want to look into plan details a little bit on this?
Sure, just for a second.
Curiosity.
And then a few more questions.
Exactly, because I think, so again, when you're going to be looking at this, there's a lot to look into. And I'm going to go right to drug coverage, but I want to make sure you know that there's a lot of information here that would talk about some of the extra benefits, which are some of those supplemental benefits, okay? But let's go straight to drug coverage and cost because it'll save us a bit of scrolling, okay? Come on, scroll. Maybe it won't. Drugs by tier. Let's just go estimated drug costs during coverage phases. There we go. So for your drugs, and again, this is Costco. I'm sorry, I didn't know which ones were the cheapest, but this gives us a good idea of what we're looking at here. So here you can look at the Zempep, which is considerably less expensive here under this plan. And your Zermilla looks like it's a bit more because I think it was closer to $500 and some dollars on the other plan. But you can see the variability in the drug costs here.
Right, and you managed to go through your coverage gap. And once you're through the coverage gap, it lowers considerably.
Right. Once you do, what is it now? It's like $9,000, $10,000 before you're hitting that coverage gap. But
right.
Yeah.
I must say we just got a note from one of the people who are watching that says the way we've done this is the first time in 3 years that it's been clarified for them to understand all of this. So great job so far. But this is where the devil is in the details, right? We put in the drugs that we might be using. We can take a look at just Part D because Part A and B are kind of set up, or we can look at Advantage plans and decide if we want to go that way. I mean, so we certainly have other, just a few more questions in our thing, but you know, this is really a good way to say, what am I going to do? Or what, you know, I was on a forum earlier today where one person did not want to go on a pancreatic enzyme because of the sheer cost of it. And we chose Zenpep not for any particular reason. There are one or two others that you could put in there to see if they would be covered under the formulary. This is where you and your doctor really at this moment in time before December 7th can go over and say, well, what am I likely to use and what are the amounts that I'm going to use, so I can proactively figure out what my costs are and be able to stay under care if this is what I want to do.
Right. And we know your drugs change. We know that. And I guess you are really, for the most part, if you're in this plan, what I would highly recommend, if you're in a plan and you get notification that a drug is somehow changing, they're changing coverage or not coverage, what you can do is basically say, I'm on this, they have to notify you that you are, the plan has to notify you that if you're on the drug, that their drug is either coming off or something's changing to it or it's costing more or whatever. And at least you will ask for a exception to remain on the drug for the remainder of the year. And I would strongly recommend that you do that. We have many people very successfully stay on drugs, even if they're coming off the plan formulary. We know that is something that we can do. So I would recommend that you do that.
So I know that one of the things, and there's just a few questions in the time remaining, and we'll see if more pop up. I'm monitoring a couple different places that these can come up, but you know, for many of us, the biggest drug that we take is an injection that's done in an infusion center, a Part B drug, whether it's lanreotide or sandostatin. Which is a very expensive drug. But is there any Part B lifetime limits or yearly limits?
No, not under Part, no, there are no limits in terms of, there are no cost limits, no. There's no.
So there's no cost limits, and certainly that has come up with the repeal of the ACA and different skinny plans that have come up, and that's more of the private insurance or the temporary insurance market that has this lifetime and also yearly thing, but not in the Medicare realm.
Right.
Looking, we kind of covered this a little bit. Of someone who is on an Advantage plan or not an Advantage plan or any type of plan, and then they're eligible for Medicare either because they're turning 65 or on disability, but they're who the rest of the family is covered under. How does it work, especially in 65 and you're kind of, you know, forced into Medicare off of an exchange plan? What would be the remedy for this? Their spouse or the rest of their family goes on an ACA plan, or how do you talk to that?
Right. My question would be, again, are we assuming that this person is there, this Kaiser HMO is not through current employment? Is that am I to assume that?
Correct.
That's what I think they're asking.
That. Yeah.
So then basically, remember, this person, they would need to get on Medicare. They would need to get on Medicare. And what that means is, what that would mean is that because Medicare only has single plans, there's no family plan in Medicare. So that means you're buying an individual plan for yourself, and then your spouse and family would need to be on a family plan through the exchange, or continue that family plan on the exchange, and then you go off and buy yourself a Medicare plan or a Medicare Advantage plan, or a Medicare, original Medicare, and then a Medigap and a drug plan. Yes, that's exactly what that means. It means expensive option.
And although, you know, given that they're also coming off and their family is still in the same kind of situation, it may not be so expensive because they'll actually be eligible for Medigap because they turn 65, and you're losing one other number as well.
Right, well, I guess that's one thing. Mm-hmm.
And looking at the one of the last questions that's up there, you know, here's another instance of someone who's been enrolled in Medicaid and they're auto enrolling into Medicare because they've hit that 25-month period, and they want to be able to see doctors in multiple states. Any suggestions on how that is?
See, okay, I think this is something that Josh, you and I had talked. We have a couple things at work here. Typically, I know if I have Medicare and Medicaid is my basically subsidizing that, I still can go, as long as it's a Medicare doctor, I can do that. Now, I know that we had talked, so if I'm on Medicare and I can go to a doctor outside my state because it's a specialist of some sort, as long as that's a Medicare provider, typically that's not an issue.
If you're original Medicare.
If you're original Medicare, correct.
Right. So then we talk about potentially people who go on to an Advantage program in Medicare. That may not be the case. That
is not going to be the case at all, because they're going to have a service area. Unless you have, you know, there are some plans which have, you know, if, like, let's say Humana, who has places across multiple states, but you're going to need to see the geographic area, the service area. If you've got a Medicare Advantage plan, regardless of whether you're on Medicaid or not, you're going to need to be within your service area to get coverage. Yeah. May not be a good choice for them. If you travel, then a Medicare Advantage plan may not be a good choice for you.
And also, I mean, there are surgical specialists in our community that only operate is probably the wrong word to talk about a surgical specialist, but we'll do it anyway. A surgical specialist who there may only be 12 in the country. And if you don't live in that state that is one of those 12, you know, you may not be able to avail yourself of that surgical specialist on an Advantage program.
Right.
One other question came up in the window about someone who is on individual Kaiser plan, and soon they'll go on to Medicare in February. Can I keep my Kaiser team? Without knowing Kaiser directly, my guess would be, or, you know, since you're on Kaiser, if you continue on Kaiser with their Advantage plan or their whichever plan, you're likely to get that Kaiser team as well, because they'll do that for you. But you should check with Kaiser to make sure that everything that you have currently stays with that.
Right. Right. That's exactly right.
Yes, there you go. You're kind of in the stripe.
I know. I'm in the center between these two things here. I know.
So I wanna thank you. It is 12:25. I'm gonna end our stream on Facebook. So say goodbye to Facebook, and I will stop our recording here. And for those, there's about 25 people who are still left in our group, or 22. I'm